That's,
Yeah, well, that's really interesting stuff. I meant to ask you what you meant by alternative psychiatry. And
someone
so
asked
I'd love to
about
go
that.
down that
Yeah.
rabbit hole with you at some time if you want.
Yeah, that's
Very
really
cool.
interesting.
Very cool. Well, happy Monday, everybody. It is March 9th, and this is the Solid Ground live stream. I am Leslie Elliott Boyce. I'm speaking today with Jennifer Friend, Christine Stephen-Wolk, and our guest is Dr. Jared Ross. And this will be a follow-up to a conversation I had with Dr. Ross the other day. We posted it up on Friday. It was about the routine practice of infant male circumcision or genital cutting. And we got into a lot of the scope of that issue, the reasons people give for doing it, some of the potential harms of it. And today we want to get into some more aspects of that, maybe follow up on a couple of viewer comments. If people in the live stream, in the chat, have comments or questions, we can get into those as well. And I'm also really curious to discuss the just what it means that we've normalized a particular form of the body. Like there's an altered form that's become normalized and in many cases is more aesthetically desirable based on its normalcy in society. What we see in our partners in pornography, for instance, like you brought up, Dr. Ross, and on and on. So how do we move from that norm if it's desirable to do so? And I think you laid out a good case that it is, Dr. Ross. So before we get into that, Jennifer, do you want to introduce Solid Ground for us?
Absolutely.
Thank you.
I'm going to read this because it's long. Solid Ground is a peer support community for anyone concerned about the imposition of critical social justice and/or authoritarian measures such as medical mandates in their workplace, university, children's schools, or community. We offer weekly online peer support groups in which members share ideas, thoughts, and support for how to navigate the impact of these ideologies and answer the question, where do we go from here? You can join our peer support group for $10 a month, and you can join our forum on locals for just $5 a month. To find out more, please visit Substack at Solid Ground Support. Please note that Solid Ground does not provide psychotherapy or legal advice, and nothing we do should be construed as such.
Excellent. Thank you so much, Jennifer. Thanks for
Mhm.
that. And gosh, it's hard to even know where to start. I'm going to post this link up to X right now so that we're live on YouTube and on X. And maybe we'll just start with any thoughts that Christine or Jennifer have around this issue. I mean, you have both, I'm sure you have a ton of thoughts on this. Christine, you're married to a Jewish man. So Jared and I talked about Judaism and the relationship between the religion and the covenant and the practice of male genital infant circumcision. But you've both just been human beings in the world for a long time. So what are your thoughts?
You're implying that we have experience with penises. I know, I know what you're trying to say.
All right,
Yes,
there you
and
go.
different ones at that. Yes.
Mhm.
I
Well,
mean, I haven't, I'll be honest, I haven't thought very deeply about it because I think it's just so normalized. It's not just the Jewish culture, my culture. So I'm Middle Eastern. We do that too as a part of, just it's interesting with my experience with it in Judaism is that it's sort of a tradition and people kind of celebrate it. There's this, event called the bris, and that's when they perform the procedure and people come by and they celebrate it. So it's really kind of out there for people to, appreciate it and to really have some strong beliefs that support it. In my own culture, it's just something that's done at birth and nobody really talks about it again. They just do it. It's just part of the procedure as much as, childbirth is part of just, you just give birth and that's just what you do. And if it's a boy, you circumcise them and there aren't a whole lot of questions. So I think, going into that in terms of how I grew up and just in general, I think I always assumed that that was something that all men did and that was just part of a process and that it kept the penis cleaner and it kept the penis it obviously looks different. And I didn't realize that until I was older and had some relationships with men that weren't circumcised, that I noticed that, wow, this is different. And it was something that I was jarred by, if I'll be honest, initially, because I wasn't used to it. So that, I think, is kind of to the extent of my experience. And now, just I've been in the same relationship now, and the same person for, over a decade at this point. So I'm not on the market in that way. So I don't necessarily think about it as an issue, or think about it as a topic of controversy, or in any way, argue, that there are two arguments to it. I don't, it just doesn't even come across to me that way. And not to say that there aren't arguments that support it and that don't support it. It's just not been something that's a part of my kind of inner life experience that much. And I was uncomfortable, I'll be honest, with having a sexual, intimate relationship with a couple of my previous relationships when they were uncircumcised. I was initially uncomfortable with it because I just didn't understand. I mean, I didn't understand it. It was probably the first time I had seen them, and that was a bit jarring in the beginning. So that's the extent of my experience. And I'd love to just hear more, since I didn't get a chance to catch the earlier conversation, about what you have to say about it, specifically, Dr. Ross, and the work that you're doing around this particular topic.
Mhm.
Yeah, thanks, Christine. I think you pointed out some of the real issues is that you haven't given a lot of thought to it. And I think we're all really guilty of that in the medical profession, in the Jewish community, in other religious and ethnic communities, and in the American population at large. This is just something that we don't give a lot of thought to, and is I think very problematic. I think as we look back, Leslie and I were talking about the history of it a little bit. I did some more research into that, and the history is just is fascinating. I mean, disgustingly fascinating. But so we have this problem where this really isn't something we've critically examined, that we're, mutilating the genitals of almost every baby boy that's born in this country, and no one's given a real second thought to it. And again, not to call you out individually here, but you said some of your experience with some of your partners who were uncircumcised. Think about that. We've taken the normative, the human form, what we are at birth, and we've given that a term based on, right? That's not an intact form or a normal form. That becomes now the abnormal. That's uncircumcised. And as I said with Leslie, I really try to avoid that word, and I'm going to really try to avoid it for the rest of the podcast here, because I think words are so powerful and they do normalize behavior. And so I think we say female genital mutilation. People don't like mutilation, but this is genital mutilation on infants, or I'll say cutting. I think is less can be less evocative for people. But yeah, it's really something that we haven't thought about, and I think that's why it's even more so problematic.
Mm-hmm.
Jared, I really appreciate the precision with language that you're encouraging, and I'll probably switch back and forth just because there's a familiarity with the particular term, but I just want to say I appreciate that.
Absolutely, and I'm not here to compel anyone's speech. I just think that whenever we're debating important issues, there's always a fight over language, and language can win and lose arguments in and of itself.
Mm-hmm.
I
Jennifer.
have a historical question. As you were speaking, it occurred to me that this is really, circumcision was tied very strongly to Jewish religious beliefs. And I am wondering, how did the procedure of circumcision spread from the Jewish community?
Yeah, so it's deeply rooted in in Jewish religious tradition, you know, in the Torah, which is also known as the Old Testament, and then it's also deeply rooted in the Muslim faith as well. I'm not an expert on that by any stretch of the imagination. But it did become very much normalized here in the US, both in the Jewish community, the Christian community, and even outside of the religious communities. And a lot of that, I think, was the medicalization of it.
Hmm.
Historically in the Jewish tradition, which is probably the exception rather than the rule for most American Jewish boys who are cut, is that this is a celebration of a covenant with Abraham that's performed not by a doctor. It may be a doctor, but it's performed by someone known as a moil, and that can either be a layperson who's trained in this procedure, that can be a rabbi, that can be a doctor. I know some physicians who are rabbis and moils as well. Um, but this is done on the eighth day of life as a big celebration. I think by and large, what you see in the U.S. with Jews what what's done with non-Jews is this routine procedure that's done before the boy leaves the hospital.
Hmm.
And so it's become very medicalized. And again, I don't think it's ethically right in either setting, but it's become very much medicalized. And I did some research, as I mentioned. I knew some of this history, that it was purported as a method of discouraging masturbation among boys. And you're all mental health professionals. Children masturbate. That's just a normal part of human development. I think it falls upon parents to make sure that that doesn't become, you know, problematic, and probably keep it in some sort of private, appropriate setting. But that's just a normal part of human development. We discover our bodies and we discover sexual parts of our bodies as well. Um, but there was this late 1800s really puritanical fear that masturbation led to neuroses or insanity, words that we don't even use in the medical community. And it was also tied to epilepsy, which is just kind of bonkers as well.
Right.
And so looking at the history, was actually an orthopedic surgeon, Louis Sayre, and John Harvey Kellogg of the Kellogg Empire, that really pushed for this to become normalized in the increasing, as Western medicine was developing, right? As we had increasing access to Western medicine in the U.S. And so that's how this became normal. And there was this idea among middle class parents that this would save their children from a life of ruin, from I guess what we would today probably call mental illness, maybe substance abuse issues, and would kind of was a way to guarantee that they would have a successful life and stay in the middle class, or uh, go up to the upper class of society.
Hmm.
Mm.
Hmm.
I want to read a
Interesting.
couple of comments here. This student of rhythm asks, do I understand right that Jewish circumcision takes off less than Western medical? Is that true, Dr. Ross?
No, I don't think there's any truth to that. There is, I would say, some very slight variability in practice, just between individual practitioners, depending on whether they're a moil or a doctor. Just individuals do things a little bit differently. How much of the foreskin they take off, but in a religious versus a medical sense, there's no overarching difference.
Okay. Another comment here, and I appreciated I guess the cognitive dissonance in this comment. David LeBoy says, to be honest, I don't really like the uncut kind, despite knowing how cruel the practice is. And so that's kind of an acknowledgement of of how we've gotten used to the norm of the form being changed. And I wanted to read another slightly longer comment from our discussion the other day, because this touches on that same issue. So William ZK9083 says, I've been circumcised since birth and I haven't got a problem with it, and everything's been fantastic and great. My German mother had it done because of severe hygiene problems that soldiers suffered in Papua New Guinea and the Desert War and so forth. It's much healthier. I like it. It's clean. It works perfectly well, and I get a lot of sexual pleasure. You guys have got a psychological issue as you think you've lost something and you haven't. He's talking to men who are upset that they've been circumcised. It's not sexual mutilation in the sense that it isn't like female circumcision, which damages the clitoris, which is like damaging the tip of the penis. So that's I think what this gentleman is expressing here is one of the sort of the arguments that's used to minimize the severity of the procedure. And I'm not sure. I mean, again, as a mother, I chose not to do this with my kids. I thought it was cruel to inflict such pain on a young boy. And I figure if he wants to do something like this to himself later in life, he can make that choice. But also, when it's compared to female genital mutilation, I'll just put this out there. Most of what I hear in my own basic understanding is that removing the foreskin, the man still can go on to live a happy, healthy sex life and have a lot of sexual functioning that work
And have
it works well
orgasms.
and have orgasms. But with female genital mutilation, you're removing more of her sexual experience than you are when you remove the foreskin. So just to put that out there, and again, it's not meant from my position to be a justification. It's just one of the arguments around this issue that keeps it from being completely analogous. What do you think, Dr. Ross?
So, I mean, I think he makes three kind of common arguments, right? One is this hygiene justification. I guess even before we get to that, he's saying, I'm happy with this.
Mhm.
And I'm like, okay, that's fine, right? But that was a decision that wasn't made for you. And I don't negate your autonomy and your ability to make a decision for yourself. But, that's like someone growing up and saying, I think it was great. My mom had facial tattoos done on me when I was a kid, and he doesn't, I mean, he doesn't know otherwise either. But we see, I guess, three main arguments, all of which we talked about last week. One is this hygiene argument. One is, I think, very unfortunate, which is minimizing the loss that some men feel, and to call that out as mental illness, I think is really derogatory and really insensitive. And then the comparison to female genital mutilation. So whereas the spectrum of male genital mutilation is generally fairly narrow, it's removal usually of the entire foreskin, and there can be issues where the foreskin, there's not a clear line, right? There's no dotted line cut here. The foreskin is part of the prepuce, is part of the shaft of the penis. So where do you draw that line is not there's no perfect demarcation. And what can happen is that whoever's doing this can pull so much skin such that you have a stricture and you don't have enough skin left on the shaft of the penis. And so when the penis becomes erect, it becomes painful. The penis can become crooked from the stricture there. So what I will say is there's much less variability, even with some variability. There's much less variability in male genital mutilation than there is in female genital mutilation. And female genital mutilation starts with, the WHO has classifications, the World Health Organization has classifications for female genital mutilation. But class 1A, the first classification, which is not the most common, but but the first classification is removal of the hood of the clitoris, which is embryologically identical tissue to the male foreskin. And so you have the same effects. You lose protection of the very sensitive glands, the glans penis versus the clitoral glands. You have keratinization or drying out and developing of skin cells, of epithelial skin cells on the glands, right? As we talked about, like the difference of the outside of my cheek versus the mucosa, the inside of my cheek, right? Those are two very different types of skin cells. And so we talked about protection and drawing out. And you have a loss of that nerve tissue. Now, by and large, more female genital mutilation involves WHO Class 1B, which involves complete or partial removal of the external clitoris. And I think it's really important that we understand the clitoral anatomy, because I think it's kind of shocking how few people understand that. The clitoral bodies are massive and extend alongside both labia down to the vaginal introitus. So what you're seeing is essentially like the tip of the clitoris, or the tip of the penis, and what embryologically is the shaft of the penis in the male is essentially buried in the labia in women. And then, female genital mutilation goes on to remove the labia minora, remove the labia majora. There's infundibulation, where the then wounds are sewn together to basically close up the external opening to the vagina. I mean, awful, awful stuff. But I will also say, on the orgasmic potential side, that any sort of genital cutting decreases sexual function, and there's no like safe amount of genital cutting that preserves orgasmic function, and there's also no amount of genital cutting that guarantees a lack of sexual function. So even women who have had very severe forms of female genital mutilation can still have intact orgasmic capability.
Interesting. That's something I had no idea about that
Okay.
until you just explained that.
I have a question. This might be somewhat silly, so pardon me if it is, but you mentioned about men feeling a sense of loss who have been circumcised, and I'm wondering, I could see if they were, suffering from some kind of impaired sexual function, certainly that would be the case. But is this the case that you know of in men that have unimpaired sexual functioning, that there's also some kind of psychological element where they feel a sense of loss due to having been circumcised as an infant?
Jennifer, I think it's a really good question. You guys are the mental health experts by far.
I've
So
never had a client discuss this with me, so this is
Me either.
really
Yeah.
new territory for me.
yeah, I think a lot of men, don't end up giving really a second thought to it until maybe they have a son, and then it's very brief, and unfortunately, there's a lot of pressures within the medical community and within the Jewish community to really normalize this practice. So I think there are a lot of men that don't, and I think that's why we don't discuss this, because I think there's some protectionist aspect here, that if we don't acknowledge that it is a physical loss of part of your body, right? I mean, there's just no way around that, whether you're amputee, people grieve that physical loss. Hopefully they were an amputee because, not hopefully, but hopefully that was performed to save their life, and not as a result of an accident or an act of violence against them. But people grieve physical loss. And then I think from the sexual pleasure side, it's very hard to say, right? Um, if all I've ever driven in my life is a Toyota Camry or a Honda Civic, I don't really know what a Porsche feels like, right? And so I think there's this question, this lingering doubt among men who, maybe even don't experience any sexual dysfunction or diagnosable sexual dysfunction. What have they lost from those 60,000 C delta fibers in the foreskin that were removed shortly after birth? And then I think you also have to, maybe less so now than 10 years ago, when the 5-phosphodiesterase inhibitor drugs, Cialis, Viagra, were being really pushed. But you have to think that there at least was, and maybe still is. I don't watch TV, so I don't get exposed to a lot of these ads, thankfully, thank God. But men are being told that they're not adequate sexually, that they need a drug to be adequate sexually. And so how does that play into things? And I don't claim to have the answers
Interesting.
there.
Yeah, one of the things that I've wondered, and I mentioned this when we were talking, Jared, I'd be interested in what Jennifer and Christine think about it as well, is I I think there must be something traumatic and it could have some impact on attachment, both sexual attachment to a partner and also attachment templates that are started early in life. If the baby starts life with a wound, if the baby starts life with a betrayal taken away from the softness of his mother's breast and put on a hard cold table and operated on, and then left to recover with a wound that's drenched in urine day after day until it heals. I mean, you've inflicted a really cruel thing on that tiny baby. And how does that impact his ability to attach to his caregivers, to his mom? How does that impact his sense of betrayal, his sense of safety? I wonder what that might do. And then later on down the line, if the sexual form is altered, how does it impact the intimate bonding experience of sex between the man and his partner? How does that alteration in form impact it? Maybe this stuff is negligible. Maybe we are really resilient and we just bounce right back from these kind of assaults. So that very well might be. I don't want to imply lots of trauma where people are walking around doing just fine. But I also wonder, what might those impacts be? And if you do that over like an entire population, what might you see in the relational dynamics that result from those procedures?
Yep, I think we just really don't know. What I'll say is I think the guidelines were just updated last year about, the importance of skin to skin contact, that in a lot of hospitals there's, we've been pushing this skin to skin for a long time, or the OBGYNs have. But there was an update last year, and I can't recall exactly. It was probably ACOG, the American College of Obstetrics and Gynecology, but I'm not certain. Uh, Talking even further that, we really need to kind of stop these delays in L&D where we, take all this time and take the baby from the mother. Like, the baby should just go, unless there's some sort of life threat or something. The importance of getting the baby on the mother and then, latching and allowing for breastfeeding is so important, from not just, physical and warmth, keeping the baby warm, because, we all know babies have limited ability to thermoregulate, but also really important for attachment and emotional attachment.
Yeah. There was another comment. This was interesting to me. Carter Steinhoff, 1994, says, near the end, Jared talked about using a lancet and drawing some blood from an infant foreskin as an alternative practice to amputation for the Jewish ritual ceremony. I just find that still to be flagrantly unacceptable violence and frankly perverse. Jared would never want someone doing that to him right now, so why give tolerance for an infant? And I think that's what's interesting to me is in this comment, and I believe Carter Steinhoff is adamantly anti-circumcision. So I believe this is not, this is coming from that perspective of just no intervention here whatsoever. It's not okay. But what I found interesting in that comment is that here's a much more, I guess, low invasion process that's being proposed as an alternative. And yet when we start to hear it, we think, wow, why would anybody do that? Like, it's just, it feels weird, right? So but the weirdness of that highlights the essential weirdness of the normalized procedure that's being done. So I wondered what you guys would think about that.
I don't know, you know, I'm of two minds about the whole thing to begin with, because I love tradition, but I'm also kind of a person who's a bit skeptical about permanent body alterations that a person can't undertake willingly for the sake of religious beliefs. Something about that, I think I'm a bit on the secular side, and something about that does not sit right with me. It does seem to me, but I also recognize that throughout history, there's been, you know, all kinds of very, you know, brutal initiation rites that people have gone through. And I do think that sometimes there's some psychological value to those. However, you know, one distinguishing feature is that these are undergone when the person is older. And, you know, an infant doesn't have the ability to consent. And so for me, you know, with my current knowledge of the situation, I find that to be the most persuasive arguments against doing that.
Yeah, I would have to agree about the consent component. It's hard for me with the traditional, you know, because I'm not, I grew up Catholic, actually. I did not grow up Muslim. So even though I'm Middle Eastern, I'm part of the teeny percentage that grew up Catholic, Christian, if you will. But I do see the amount of kind of pride and closeness that the Jewish community, at least that I've been exposed to through my husband, that they have around tradition, and how meaningful it is for them to connect and to feel a part of each other and a part of something that's very meaningful, that's very, you know, soul fulfilling and gratifying to do. So, you know, I can appreciate, I think, both sides of that. I lean toward the side of the tradition, I think, because I'm biased, I would imagine, having been really engulfed in that culture now for quite a long time. Um, and so I, I'd hate to trample on that, but I also understand that there are plenty of things that were traditional practices that were brutal and are still happening that are brutal. Um, Female circumcision, I remember being in college when that was such a huge issue on our campus. And I remember going out and protesting and getting involved in any way that I could, because that was so severely violent in my viewpoint at the time. I mean, I still think it's severely violent even today.
How did that become an issue on your campus?
People were talking about it happening in other parts of the world. And so
I
it was
see.
sort of, yeah, it was like this, you know, it was during this Take Back the Night type of initiative where it was
Uh,
about women, you know, being treated a certain way, being treated as equals, and not being, you know, harmed for the sake of being women. And that was happening in other parts of the world. I mean, it was happening in the Middle East a lot too, as a matter of fact. So that was something that was so wrong. So maybe in some way I've got this bit of hypocrisy about it in my mind that I kind of wrestle with. But I can see the argument where it is something that, you know, you're taking away somebody's right to consent for something that's a permanent physical altercation or mutilation, if you want to call it that, whatever language we use to describe
mm,
that.
mm.
But there still seems to be a difference for me between that component, and the traditional component, and then the female mutilation, which I think is not. I mean, I think it's not as, I don't know that we're comparing apples to oranges, or if we're comparing fruits to vegetables. Like,
Saying
I
it's
don't know
not
how close
you're
it is.
not analogous.
Yeah, yeah.
Yeah.
Brian Lewis asks, do you know of any men who choose circumcision for themselves as adults? And I wonder what
You know
what you
what?
know.
This came
Yeah.
up on a Sex and the City episode. I have to say, I
Oh,
watched that
okay.
show religiously, and it came up on an episode of Sex and the City. I'll just give you this little anecdote for a minute. Where one of the characters is dating a guy who isn't circumcised, and she's kind of horrified by it. And he decides, because of that situation, to go and get circumcised as an adult. And um, he talks about how painful it was, but then he ultimately is happy he does it, leaves her, and starts going around and dating all sorts of women. He's like, I don't want to be settled down now that I have this new and improved body part.
Got to show it off.
I got to go show it off. So that was the only time I've actually ever heard of an adult male choosing to do that. But Dr. Ross, you may know more about that on a medical level than that.
Yeah, it's not very well studied. It's not uncommon. There are adult males that, for a variety of reasons, mostly cosmetic, choose to undergo the procedure as an adult. There's some pretty poor quality research looking at regret rates in these men that I think attempt to justify infant male genital cutting.
Mm.
But it's again, I think it's not really talked about, and when it is talked about, it's talked about as, unfortunately, oh my gosh, this is so much of a bigger deal, and it requires anesthesia. And that was, something Leslie and I were talking about. But baby boys don't get anesthesia, and it's probably not a lack of need for anesthesia. It's just that they're babies and they can be strapped down, and we tolerate this societally that we just really don't aren't willing to tolerate as adults. But I think it kind of ends up being an argument of the ends justify the means. And I don't think that's, an acceptable ethical argument. I think that it's really, any benefit aside, we didn't, and I know, Leslie, you read that comment about hygiene, and I forgot we didn't really get in today to debunking the hygiene myth. But at the end of the day, there's really no justification. As a religious and observant Jew, I just had a bunch of Jews over at my house this weekend to celebrate the end of the Sabbath. So I'm very much involved in the Jewish community. I was just at two different shuls over the last week, synagogues, and I just don't think there's any way that you can justify taking autonomy from a child for a cosmetic procedure. And that's really what this is. This is altering form, destroying function, and has no medical purpose. I mean, there's some very kind of edge cases, and I'm happy to get into them. One is called hypospadies, and it's a condition where boys are born with the opening of the urethra, where the urine comes out of, on the underside of the penis rather than at the tip of the penis. And so this is not uncommon, and usually corrected through a surgery in very early childhood. And usually this surgery utilizes the foreskin to correct that defect. So usually these boys' foreskins are completely or partially removed. There's actually some research out there as to how to repair hypospadies without removing the foreskin, because that's a request that some urologists get. And then there's actually a huge educational component that goes out to pediatricians and obstetricians. So those are really the two specialties that perform infant male genital cutting. It really kind of depends regionally and based on the hospital, whether it's the pediatricians doing it or whether it's the obstetricians doing it. In the adult male, it's almost always done by a urologist. And urologists kind of very rarely end up doing it in children unless there's some medical indication, legitimate medical indication for it. But it is a board certification question. It's so important that it's on the board certification. And I don't recall whether it's for pediatricians or for obstetricians or maybe even for both, is that you have a boy born with hypospadias. What consideration do you need to take? And the consideration is that you don't remove his foreskin. And so again, to have ingrained in our medical education system, in our testing that certifies you to be competent to practice in these two fields, to say that we're gonna test you specifically on this, and then we're gonna word this as this is a specific precaution you need to take. This is a special, whereas we've really flipped our whole point of view, our whole worldview, as to say, no, this is an abnormal procedure. We're modifying the body. We've reframed this to be that the intact male body is abnormal.
That's so interesting.
Yeah. So I have a strange circumcision story. If you could shed some light on this, it's really it's a little bit so I had a friend years ago who had a son, and she didn't have him circumcised, and then when he was around 12 or 13, he developed this medical condition. I don't know the term for it, but essentially the way she explained it was his foreskin had kind of grown up and over the head of his penis and was interrupting proper urination. And she told me that this can happen sometimes if you don't sort of manipulate. You're supposed to kind of manipulate the foreskin so that it remains flexible, and he hadn't done this or been told to do this. So he ended up having a circumcision for, it sounds like, legitimate medical reasons when he was around 12 or 13. But I had never heard of such a thing before. Apparently it was quite painful too, from what I was told.
So Leslie and I actually discussed this last week.
Okay.
It's a condition called phimosis, where the prepuce or the foreskin can't be fully retracted around the glans penis, and it can disrupt urination. It's not an emergency. It's it's rare. It occurs, but it's rare. I had pulled up some of the numbers here. It looks like maybe 3% have some degree of phimosis. So what's important to keep in mind, and we talked about this last week, is that the foreskin, the inner surface of the foreskin, is actually adhered to the glans penis, just like the clitoral hood is adhered to the clitoris, and that those adhesions start to break up as sex hormone levels spike during puberty. And that's not a problem. Actually, there's a lot of important education especially with handling males, to not forcibly retract the foreskin. A male child will not forcibly retract their own foreskin because it becomes incredibly painful. And when they're ready, they'll figure it out. It's not a big deal. I don't think anyone has to be told to do it. We certainly, again, and the foreskin isn't unique to humans. Every mammal on this planet was born with one. So we don't have problems in the animal kingdom with this. And going back to Homo erectus, predating Homo sapiens, you have 6 to 7 million years of human existence, and for a large part of that, there there was limited language, so I'm sure no one was telling boys, oh, you got to make sure to do this. So, again, I think this becomes this, edge case scenario. But the good news, and I think Leslie talked about this with her friend and colleague whose son was going through this, is that most of these are handled with stretching. There's some creams that can be used.
Yeah, okay.
In more severe cases, they can insert a balloon to dilate the foreskin just to blow it up with air. Um, and if it's very severe, you can cut a slit in the foreskin, right? Because the foreskin is a 360-degree structure.
Yeah.
So you can cut a slit or sever. There's, oh my gosh, my anatomy's failing me here. But actually, at the end of the foreskin, there's a rubber band type structure that actually keeps the foreskin around the glands. And so you can actually just snip a portion of that. But removing the foreskin for phimosis is quite extreme. And I would say in the vast majority of cases, I would even venture to say is probably never indicated, is probably never necessary.
Interesting. Okay.
But I think given our societal normalization of the cut male penis, it in very many situations just becomes a first kind of gut response. Is like, oh, we'll just cut it off. And Leslie, you talk about your story, because that was really wonderful to hear.
Oh yeah, when I was it was a year or two ago that I accompanied a young mom whose son was having some issues with his penis. She wanted to get a specialist to check on it. There was some ballooning of urination and some other issues with constriction, and she was worried that she'd be pressured into circumcision as a first run, and she didn't want to have an unnecessary surgery for her son. So what it ended up being, and that was the first thing suggested. And I don't know how it would have gone if I wasn't there. Just having somebody else to advocate and ask some questions was really helpful. But the solution was a cream. It was a steroid cream that was used. And so that was much less invasive.
Wow.
Much less intrusive intervention.
Yeah.
Right. I want to read a couple more comments here because there's been so many good ones. And then we can see which ones you want to respond to, Dr. Ross. Magdalena 8713 says, is it a requirement for conversion to Judaism to get circumcision? And then Student of Rhythm says, how do you advocate against circumcision and tell Jews that their tradition is barbaric and avoid lapsing into anti-Semitism? So that's another one, another good question for you. Magdalena also says, by the way, interesting enough, I'm fairly sure Germany, of all places, banned child circumcision some years ago on a human rights basis.
Wow.
And there was another one that was pretty good that I wanted to read. 1213 St. Marie. One reason I didn't have either of my sons circumcised is I saw one done. I was a nurse for many years. After seeing a circumcision, I decided I wasn't going to put my baby through that. Magdalena also asks, is this controversial and or being discussed among rabbinical leaders today? So I'll leave it at that, and then we'll read some more if we get a chance to.
Yeah, all wonderful questions. So the conversion one is kind of low-hanging fruit, easy to hit on. And the answer is it depends, because Judaism is not a centralized religion. There's no central rabbinic authority. So it depends on the community and or synagogue that you belong to. Generally, in the Reform and conservative world, it is not a requirement. And generally, in the Orthodox and ultra-Orthodox worlds, it is a requirement. And then we talked about Brit Dom, which is what those Orthodox sects do for men who have had their foreskin removed at birth, who then convert to Judaism later in life. And of course, you can't cut off something that was already cut off. So
Right.
what do? They ritually let blood, and it's bloodletting. And I think as Christine talked about that, is that using a lancet, is that perfect? By no means. I mean, it's not altering form, right? It's causing momentary, much more mild pain. I guess, one of the things I say is that we've got plenty of people with diabetes who are poking their fingers, and not their penises, their fingers, but 4 to 6 times a day with this. So is it okay? We also do things that cause pain to babies, right? We give babies vitamin K shots right after birth. Babies are at high risk for clotting disorders that can cause them to bleed in their brain and have very severe outcomes. So we give a vitamin K shot to babies at birth. So we're giving them a shot with a bigger needle, intramuscular shot. And I want to be very clear, that has very clear benefits, right? We have a risk benefit analysis. We're causing some pain for a very specific goal with very robust evidence around that benefit. This isn't causing any benefit, but it seems like a reasonable alternative. But again, I agree. It's not ethically problemless. It still has problems. Um, in terms of legalization, Germany has attempted to outlaw it. I don't believe we have any country in the world that has successfully outlawed genital cutting on boys. We have many countries, including the US, that have outlawed any form of genital cutting on females, including sole removal of the clitoral hood, which is embryologically from the embryo the same tissue as is removed in the male. We do unfortunately have a massive rise in female genital mutilation here in the U.S. now, due to a large increase in the Muslim population. And so there have been several
Who's
doctors.
doing those? Are just non-medical people are performing these?
Both. So non-medical, and I don't know if they're religious leaders or lay people on the religious side of things, but both non-medically trained, as well as a few years ago, there were a couple doctors in Detroit, Michigan, which is where I trained. I did my residency in emergency medicine, that were imprisoned. Both Muslim physicians who were performing this on girls in the Muslim communities down in Dearborn and Dearborn Heights, south of Detroit. So yeah, really a problem. But Germany has tried to push back on this. I believe Finland and Iceland have all attempted to pass bills. California actually had a bill that was passed that was vetoed by then Governor Arnold Schwarzenegger. So there's a lot of there. I think there are a lot of people who realize this is a very serious human rights violation. But what happens is, as soon as you start questioning this practice, you become labeled an anti-Semite and an Islamophobe, and it is very hard to
Unbelievable.
argue that. Yeah,
That's just, to me, that's manipulation.
it really is. It really is. To be willing, I think we have to be we have to show some grace, but we also have to be humble and come to the table and be willing to critically examine ourselves and our faith and our traditions, and to say, let me give this a second thought. Let me examine this, and let me think about this. And again, regardless of any justification, HIV, hygiene, urinary tract infections, sexual preference, sexual function, preventing complications, it before you get into any of the weeds there, it just becomes a clear ethical issue is that you're performing cosmetic surgery, you're altering form, you're not improving function, you're destroying function, and you're doing so without consent of that individual, and that's just completely unacceptable.
How does the Jewish community respond to your views? Does this cause problems for you socially? Like, I'm guessing people are not inviting you to a bris or anything.
Well, that gets back to the other question when you're saying
Yeah.
that some of these criticisms of procedures that are more common for Muslims will be labeled as Islamophobia. And one of the commenters asked about this, like, how do you criticize this thing that's really central to Jewish tradition without being cast out as an anti-Semite? Like, how does your argument land?
Yeah, the
And I know,
question's what made me
yeah,
think of that.
yeah.
Yeah, it's generally not handled well within the Jewish circles. I've been to a few conferences. I was actually just invited. I gave a talk at GenSpec's conference in November. GenSpec is an organization that kind of fights against the medicalization of kids who are struggling with their sexual identity.
Yeah.
And wonderful organization run by Stella O'Malley, who's
Hmm.
a mental health professional, a therapist out of Ireland, and so huge shout out to her. But I was invited to speak out there on a panel, and the panel was about taboo topics in medicine. So we kind of talked about how and thankfully that tide is changing, how it's taboo to push back on so-called preferred pronouns and to push back on these, patients who are confused and delusional, that we are forced as physicians and mental health professionals to this is the only delusion we're required to buy into. All other psychiatric delusions we're actually ethically obligated to not
Right.
to not buy into and not foster. But this is one we are. And I talked about the male genital cutting as well with this. And I guess a, a few weeks ago, that video got to the attention of the director of Intact International, which is a newer organization out of Los Angeles. And so they have their second annual conference next month and invited me out there to speak. And then this kind of came up right at the same time as Leslie and I had reconnected to speak about it. But sorry, to circle back to your question, I had been at a conference several years ago from an organization called Intact America that's probably one of the biggest out of New York, Georgianne Chapin's organization. And I was actually surprised that probably about 20 to 25% of the people there were Jewish in some sense of the word. Some of them had grown up in the Jewish community but weren't practicing. We had some very observant Jews who observe the Sabbath, who don't, use their phone or operate a vehicle or use electricity from sundown on Friday to sundown on Saturday and keep strict
Mm.
kosher. So really a broad spectrum there. I was actually very surprised by not just the number of Jews there, but the kind of diversity of Jews out of the whole group there, the diversity of political views, people from the very, very far left to the very, very far right there, and everything in between. But very interesting. So how do you make this argument? I think you make this argument in good faith, which is why I'm making it, and I think why most people make it. I think there are, unfortunately, a small group of people within the intactivist movement that are doing this in bad faith, that are doing this um, as part of an anti-Semitic motivation. And I think what's really unfortunate is that a lot of times those in the Jewish community, instead of engaging with the issues, instead of engaging with the issues surrounding autonomy, immediately start throwing out. It's much easier to go to slurs, right? Oh, you're just an anti-Semite. Even me, it's like, oh, you're a self-hating Jew. Um, so it's very easy to go to slurs, but I think you just have to approach this honestly and ethically, and I don't think there's any magic bullet to convince people that you're doing this for all the right reasons.
It reminds me of the if you don't vote for Biden, you ain't black, that it's real easy to enforce compliance through like identity digs that way. So we're at time for the stream, and after the stream we go to a members only chat. So we'll stop streaming, stop recording, and invite our members in to talk some more about this issue if there's interest in continuing the dialogue. I think it's very interesting. I think that it seems like there are several different major areas of exploration here. You can talk about the normalization of a particular form. Think the pressure that girls feel, or it's especially like the 90s and early 2000s to get breast augmentation because form normalized in a particular way. And so there's a similarity there. There's also the ignoring of the pain of a person because they won't remember that pain. That is really interesting because this procedure being performed at a particular time with the excuse that the baby won't grow up to remember it. That's an issue I think relates to the treatment of the elder abuse that we see in old folks' homes. I mean, MAID, I think we have a lot of correlates here within the bioethics field and so much more. So thank you all so much for being in this chat today. I think that this was a really great dialogue. A lot of really mature and complex questions that are being raised, and I appreciate everybody's engagement with it. And Dr. Ross, thank you so much for your time. Can you tell everybody really quickly where to find you if they want to follow up? And I'll include those links in the video description as well.
Yep. And again, thank you, Leslie, and thanks to you, Jennifer and Christine as well for having me on. It's really a pleasure and an honor to be on. I can be found at drdrjaredross.com, launching a new website there, hopefully middle of next month. And I'm most active on Twitter or X. Sorry, I still can't get used to that. And that's also at drjaredross. It's JAREDROSS. So look forward to engaging with people there.
Wonderful. Thank you again so much for being here. And thank you everybody for joining us in the live stream. We will see you next Monday.